So we'll be looking at the thorax. Yeah, where is it? We are looking at the thorax. Okay. So the thorax is the area of the body situated between what? The neck and the abdomen. Okay. The thorax is the part of the body that is situated between the neck and the abdomen. So you say that the thorax is what? Inferior to the neck, and then what? Superior to the abdomen. The thorax itself is split up into areas that contain important structures. In fact, all structures, all anatomical structures in the thorax are so important. They are so vital to life. Okay, all the structures in the thorax are so very important to life. So we've established the premise that the thorax is situated between the neck and the abdomen, and the structure that separates the thorax from the abdomen is what we call the diaphragms. We have a pair of diaphragms in the normal human being. Okay, so the thorax is bound by bony structures, including the 12 pairs of ribs and thoracic vertebrae, and is also supported by muscles and ligaments. So we know that we have 12 ribs, which are coming from uh, the 12 thoracic vertebrae. Then the walls of what? The thorax is protected or is enclosed with muscles. Example is the pectoralis major, the pectoralis minor, the latissimus dorsi, a whole lot of muscles. There are a lot of muscles in the thorax. Okay. So the muscles of the thorax are also important for the vital organs. Yes, we have breathing. We have the intercostal muscles. They aid in breathing, and a lot others. The thoracic cavity is home to many vital organs, and these are the vital organs that we mostly look at. We are looking at the heart, the two lungs, we are looking at the great vessels, we are looking at the diaphragms, we are looking at the trachea, we are looking at the bronchi, we are looking at the alveoli. Okay. Aside the ribs, other bony structures there, we have the sternum, the manubrium, we have the clavicles, we have the scapula. Do you understand? So all these are structures that we will look at. All of these are structures that we look at in the thorax. So let's jump to the organs of the thorax. We wouldn't bother ourselves much with the bones and all that. But let's look at this. Areas of the thorax. Okay, let's look at the areas of the thorax. The thorax is divided into areas. We have what? The superior mediastinum, the middle mediastinum, the anterior mediastinum, the posterior mediastinum. All of these you are supposed to know, and you are supposed to know which organs are there. So for the superior mediastinum, that is the area of the thorax above the sternal angle. You know the sternal angle. You know the sternal angle. The junction between the sternum body and then the manubrium. So the areas above the sternal angle at the level of T4 and between the thoracic aperture, it includes the structures like the aorta, the aortic arc, the superior vena cava, the trachea, and the vagus nerve. So that is the upper part of the mediastinum. We also have the middle mediastinum, which contains the heart itself and then the great vessels, the tracheal bifurcations. We will look at this when we get to the images, especially on the radiographic image. We also have the anterior mediastinum, contains parts of the heart, the aorta, the esophagus, and all that. Let's look at so in our chest X-ray or in radiography or in imaging, when we are looking at chest X-rays, the most important structures that we are looking at, we are trying to detect if there is no pathology, is the lungs, the lungs, the right and left lungs, then the heart, then the great vessels. The great vessels, we have the superior and inferior vena cava, the aorta, the pulmonary trunk, pulmonary veins, these blood vessels. And then we have the ribs, okay? And then all the other structures of the thoracic wall. But these are the ones that we pay much close attention to. When you get to level 400 or 300, you are doing your pattern recognition. You see that you do a lot of things about the chest. Now let's look at this place too. Organs of the thorax. Let me read. The organs of the thorax include the thymus gland, the breast, the heart, the lungs, the tracheobronchial tree, and the pleura. You will see all these on the chest X-ray, except I think except the thymus gland. It is not very clear. The density of the thymus gland and then the other structures around it, they are the same, so you don't really make it out. And then the breast is more pronounced, more visible in the females. You don't see the male breast that much on the chest X-ray. The heart is there. The heart is really really opaque. It's sometimes if the exposure is not even um, that high enough, if you underexpose the image, you see that you will not be able to see the vertebrae, the thoracic vertebrae behind the heart. And I told you why the heart appears so really opaque. It is because of what? The calcium ion that is in the heart. And it is the calcium ion that causes the heart to undergo its spasms that leads to the contractions. So when you learn about action potentials and all that, you get to know that uh, the heart and muscles, smooth and skeletal muscles, their contraction is dependent, highly dependent on what? The calcium ion. Okay. And so the heart is a major organ in the thorax, in the middle mediastinum. We know that the heart has four chambers, right? You have uh, two atria and two ventricles. The atria and the ventricles are separated by valves. We have the tricuspid valves on the left, on the right, and then the bicuspid valve on the left. We also have the aortic valves and then the pulmonary valves. These are things that you should know. The heart is covered by a pericardium, and what have you? You can look at the tracheobronchial tree and all that. So we have an image of the tracheobronchial tree here. So one thing that you should know is that the vital organs that are in the thoracic cavity are the organs that are used purposely for respiration and then for blood circulation. So we have the nasal cavity, the pharynx, the buccal cavity, the pharynx. So nasopharynx, oropharynx, the larynx. Then you enter the trachea. Then the trachea will bifurcate. The point at which the trachea bifurcates is called the carina. It is a very important structure in radiography, that particular place. So the carina, at the carina, we will branch into what? The right and then the left lungs. These bronchi will branch into what? Bronchioles. We have different levels of bronchioles. We have lobar bronchioles, segmental bronchioles, terminal bronchioles, and what have you. You are supposed to know them. And because these bronchioles and bronchi and trachea contain air, their their normal radiographic anatomic appearance should be what? Radiolucent, black. So in any case, if you find some radiopacities in the lung areas, then you know that there is what? An abnormality. One thing that you should also know is that when you pick up the lung, the right lung is made up of what? Three lobes, three lobes, but the left is made up of what? Only two lobes. The right lung is made up of what? Three lobes. We have what? The upper lobe, the middle, and then the lower lobe. But on the left, we only have the upper lobe and then the lower lobe. And some people say that the reason why we have only two lobes in the left lung is to compensate for the positioning of the heart, of the cardia. I don't know how true it is. So please find yourself this particular website, or they have a mobile app. It was really helpful to me when I was a student. Now let's look at the pleura. The pleura refers to what? The serous membranes that line the lungs and thoracic cavity. So all organs in the body, those in the abdomen, those in the thorax, all organs in the body, even the brain, they are what? Covered with what we call uh, pleura. Okay, we have neural pleuras, and then we have the visceral pleuras. Okay, we have mural. The pleura can be mural. It means it covers what? It lines the cavity. It lines the walls of the cavity that contains what? The the organs. And then we have another viscera, which is in direct contact, with what? The organs themselves in the cavity. So we have visceral pleura, and then mural pleura. I think there is a more appropriate name that they use for it. I've forgotten. That's why I'm using mural. Mural too is right. If somebody knows, the person should find out. So sometimes in one common condition that we mostly experience in the radiology department is pleural effusion. So somebody might come to the hospital, a patient, and then you would take a chest X-ray for the patient, and you see that the costophrenic angles, we will look at them, of the patient are blunted. And why are they blunted? There is what? An exudation or a transudation of fluid from within the lungs into the pleural space. Already there is some level of fluid in the pleural space, but that is just right to keep the pleural space moist. But when there is an injury, yes, when there is an injury or when there is an infection or there is any pathology within what? The lungs or within the thoracic cavity, this infection or this pathology or this disease can lead to fluid accumulating in the pleural space. Yes, parietal pleura and then visceral pleura. Learn about all these things. So there's an image. I think this on the CT and MRI images, and some new type of ultrasound will show you this image. We will look at them when we get there. Okay, what can I show again? Let's look at the lungs themselves. So as I said, we have what? Two lobes on the left and three on the right. The lung is also divided into segments. So we have the lungs here. We've already looked at it. Now, on the chest X-ray, you see that on the lungs, you appreciate a radiolucent what? Structure, the pair of radiolucent structures. But within the radiolucent structures, you see some lines passing through it. When we get there, you see some lines overlaying the radiolucent structure, and that is a representation of what? The pulmonary blood vessels, pulmonary capillaries, pulmonary arteries, arterioles. Let's take a look at the heart too. See, this place you can come and learn all your anatomy here. You can come and learn all your anatomy here. It goes into good details for you. So the great vessels of the heart, we have what? The aorta, the ascending aorta, which branches into three different vessels. We have the pulmonary trunk, which bifurcates into the pulmonary arteries, two pulmonary arteries. We have the superior vena cava, the inferior vena cava, the pulmonary veins. All these are appreciable on the chest X-ray if you learn it very well. I may not teach you everything. I cannot teach you everything. But then with practice, you will be able to see things that somebody will not see. You will be able to locate the positions of even the ventricles, and the atria and all that. Okay, so let me get my image so that we can work with it. Hey, who sent nope? Abigail Chura, what is happening? Dr. Boots, what is happening? Okay, so I've gotten an image. I've gotten the image that I want to use. So I will share my screen. Please let me know if you see the image. Okay, let me know if you see the image. Mm, coming. Let me try and see if I. Good. Are you there? Please let me see some emojis. Okay, Joshua. Right. So do you see my screen now? Do you see the chest X-ray image on my screen? Great. Nice job, Joshua. Nice job. All right. So this is a chest X-ray image. This is an image of a very well taken diagnostic chest X-ray. Is it well taken? Yes, it is. Very well taken diagnostic X-ray image. Okay. So let us identify the structures on the chest X-ray. So remember, we have our marker here. Do you see the cursor? Do you see my cursor? Okay, Theophilus, you can see. All right. So you said you don't see my cursor. Somebody should send a message whether you see the cursor or not. That search, uh, I don't know. All right, you can see. Good. Okay, so we have an image of a chest X-ray. Have a chest X-ray image. So we will start identifying some of the structures. Let's do it here. Afterwards, I'll open one app and then type the names there. So pointing to the A, we have what? The trachea. Okay. This radiolucent structure from from the neck. I think it's coming from the C spine. Down here. When it gets here, then bifurcates. One passes here, and then another one passes here. So this is the trachea. The trachea. We know that the trachea contains air. It's also called the windpipe. And for the trachea, we don't have right trachea and left trachea. Why? Because it is one organ. We only any normal human being has only one trachea, right? And it's a midline structure as well. So we don't have right trachea. Delight. Don't write right trachea. Okay. So we have the trachea, and we know from our anatomy is that when the trachea gets to the level of the carina or the carina, which uh, corresponds to the level of the sternal angle, it bifurcates into two bronchi, two main bronchi. We have the right main bronchus, which is at this side. I will repeat this. We have the right main bronchus here, coming into what? The right lung. Then we have the left main bronchus, which takes some kind of path. It bends. Okay, that the left one bends, and it is less patent as compared to what? The right. The right is just so patent, right from the trachea, you enter the right. But for the left, it gives some curvature and then enters what? The left lung. And so when there is a case of aspiration, when somebody, maybe a child, a kid might have inhaled something like a corn or a seed or a coin or something, seed or a bro, something like that, or button, there is a high probability that that inhaled or that aspirated substance will go and lodge into the right main bronchus because of the positioning and the patency and how continuous the right main bronchus is with the trachea. So this is the trachea. This is the trachea from what? From the neck to get to the carina, will bifurcate into the left main bronchus, the right main bronchus, and the left main bronchus. This is right. Look at the marker. This side is right. This is the right side. So right main bronchus, left main bronchus, then into branch, 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 branch. We also have the lungs here. This is the right lung. The whole of this place from here down to here. All of this is part of what? The right lung. I'm coming. Let me see how I can use the paint application. Can you see my screen? Oh, okay. I think most of you don't see the screen. So I think we'll have to cross to another streaming app. I have another streaming app, but I haven't used it yet. But let's go to maybe Zoom or Google Meet. Then I'll be able to show you that one. I want to label as I speak. I want to do some demarcations and all that. So sorry for the inconvenience. I'll create one link for you right now. Then yeah, we'll take it up from there. Okay, so let me end this streaming and branch. I mean, go to the next another streaming app, online meeting app. Then I'll use that one. I'll learn how to use the other app so that we can use it. I know you can see, but I want to show you some image. I want to show you a particular window, but it is not appearing. So let's go. Let's go. I'm ending the stream. I'll send you a link right now so that we can use.